All right, Dr. Kyle Lovelace here again, your spine expert. Today's lesson, we're going to be talking about how to strengthen your spine and how to make sure that you have a strong, healthy spine and nervous system. If you remember, your spine and your nervous system are some of the most important organs in your body, controls everything in your body, so we want to make sure that's a strong, stable structure. I'm going to give you 12 easy and effective exercises that you can do at home and on your own to make sure you have a strong and healthy spine. Okay, so our next exercise is tabletops, and these are really good for the core. It's really good at strengthening the overall spine throughout. Okay, so Rachel's going to demonstrate what a tabletop looks like, and as you can see, she's going straight out, and each opposite arms, opposite leg. At the same time, you can see it's strengthening through here. It's going to work a little bit on the abdomen, but more than anything, it's going to strengthen that lower back area and work its way all the way up through here. Okay, so our next exercise is going to be your core stabilizing exercise. And this is more of a balancing thing. The more balance you have, overall, the stronger your spine is going to be. And so the first one, this is really the beginner's balancing act here. And so Rachel's going to do this. She's going to stand on one foot at a time, right, and just hold her balance. It's very simple. But as you can see, if you're not someone that's balanced, this is something you're going to have to really pull those core muscles in for. Okay, so that's the beginner one. The next step up is going to be standing on a wobble cushion. Okay, so Rachel's going to stand on this wobble cushion here. And so as you can see, as she's staying on this cushion, there's a little bit more balance. She's going to have to really pull those postural muscles to hold herself, the stabilizing muscles. And how's your abs feel? Yeah, so it's literally flexing her abs. So this is something, you're going to hold this for about a minute and just stand on these things and do this about 3 or 4 times. You can do this all throughout the day. I would try this every single day, and it's awesome because it strengthens the core, but you know what it also does is it also works on your brain, and it just keeps your brain in this ability to start to work with your balance and your proprioception in general. So this is a really great exercise overall for your posture and for your strength. Okay, so your next exercise, as you can see here, Rachel's laying on the ground, so we're about to do some planks. And the plank is an exercise that really strengthens the core, really in the abdomen level, but also strengthens your low back as well. And here's the thing, so go ahead and do the plank. And so this is the beginner way. She's on her knees, and as you can see, it's flat throughout. Right, you see her shoulders and elbows are straight up and down here. There's a good, strong core. And what she's going to do is pull her belly button to her spine. So literally flexing her abs. And how's that doing? Yeah, so it's hard. So it's strengthening the abdomen. Good. The next thing we're going to do is the advanced plank. Okay, so go ahead and do the advanced plank. And that's just a normal plank. And you can see her back straight. She's sucking her belly button up to her spine, strengthening the abdomen. And that's going to be for someone that's a little bit more advanced. You can relax. Okay, so you're going to want to do this for about 30 to 45 seconds. If you're really good at this, do it up to a minute. And you can do this about every other day. This is a really good ab exercise, but it's really good for strengthening the core of your spine. Okay, your next exercise, this is one of my favorite ones to do. And this is, you use the foam roll right here. And you might have seen one of these before. A lot of sporting goods stores will have these. We have these on our website. But you literally take this thing and you roll up and down it, and it helps put full motion into your spine. Rachel's going to show us how this thing works here. Good, so you can see she's putting that on her back, she's rolling up and down, and sometimes you'll feel like a popping feeling. Those things are fine. That means it's getting releases in your spine. It gets full range of motion in there, and see how she lets her body just kind of wrap around that thing. Good, you can come on up. Another thing you can use very similar to this is maybe one of those exercise balls to lay your whole body back over it and stretch out your spine. This is great. You can keep one of these at work, or you can have one of these at home before you go to bed, maybe first thing when you wake up in the morning, or even before and after you exercise. Very solid workout, and you're going to love the foam roll. Okay, so our next exercise, this is another one of my favorites, and this is because it gives full range of motion in your spine. This exercise I'm going to teach you right now actually helps pump your disc spaces, and use something very simple. You can get any sporting goods store. We have these things on our website as well. I call them wobble cushions. They go by all different types of names. But Rachel's going to show us how this wobble cushion or wobble chair exercise works. Okay, go ahead and have a seat on here. Good. Okay, so the first thing she's going to do is go side to side. Okay, so as she does that, you can see full range of motion in her low back. She's getting full range of motion in her neck, side to side. And what that does is it actually pumps your disc space. Now, every day we need to be pumping the fluid in and out of our disc. We have to replenish that fluid. The average American right now does that about once a year. And the reason is because you don't replenish the fluid unless you move. And about 80% of our day is spent sitting at a computer. So having one of these at work can literally change your world. It'll change the amount of back pain that you have. But even more importantly, you heard me early on talk about how prolonged sitting. They prove that prolonged sitting increases all-cause mortality rates. Well, Rachel's not just sitting here, she's getting full range of motion, pumping the fluids in her spine, pumping her blood, getting oxygen, and so that's actually going to decrease mortality rates by moving on a regular basis like this instead of just sitting at a computer all day long. And so this is how you want to do it. As she's going side to side here, she's going to do this about 60 times side to side. The other one's going to be facing the other way, going front and back. So go ahead and face the other way. We'll turn the full chair so they can see you here. Okay, good. So the next one is she's going to go front to back. Perfect. So you can see full range of motion, still pumping the disc space, helps stretch out the muscles, get the ligaments, everything moving. This is an awesome exercise. Before I do any kind of care with my patients, I always have them warm up like this because I know they're ready, their spine's nice and relaxed to get their best adjustment. Okay, so your next exercise, and this is one we do in our office every day for a patient before they do any kind of care at all, is to traction the neck out, get the discs pumping and get full range of motion in the spine. Also helps cerebral spinal fluid pump the way it's supposed to. So go ahead and do your neck traction. Good, so that's tractioning the cervical spine, that's tractioning your neck. Gets full range of motion in the neck. It actually helps to put, as you can see, it puts a little bit of a curve in the neck, but it also pumps the disc space. Okay, now you see, well, there's equipment here that might not be easy to do on your own. This is very easy equipment to get. You can stop now. The only thing I recommend on this one is to make sure that you probably talk to a doctor before you do this. If you have any kind of major disc issues or you have any kind of spinal problems that could get worse with this, you always want to talk to a doctor first. But this is a great exercise to help pump the discs and get your spine healthy. Okay, so the next exercise, this one's awesome. This one's very simple to do. Anybody can do it. And I actually recommend having your kids do this one as well because so many kids have this forward head posture issue now. And these are called wall angels. Okay, so go ahead and show us the wall angel. Good. And so she's going to get everything touching the wall. Her heels are touching the wall. Her butt's touching the wall. Her back's touching the wall. Her head's touching the wall. Her hands are touching the wall. And you can see her hands are out like this. That's going to open up the chest area. It's going to get your head back. And I want her to hold this or do this for about 3 minutes. Okay, and you can even get to the point where you go up and you stop right here. Bring your arms down just a little bit. You can hold it just like that and you'll feel a full stretch. And holding yourself there with your arms in these positions like this opens up the chest area. One of our biggest problems is because we're like this all day long, we start to get like this, we get this hunchback position. Well, this wall angel, holding it for 3 minutes a couple times throughout the day will help you hold or help retrain your muscles to actually be in this position. And you'll notice, go ahead and come off the wall. When you come off the wall, you notice how you're in that posture position. You're literally standing up better. Okay, so this is a great exercise to make sure you're building your posture back to counteract the crazy being at a computer all day long or sitting with your head down for long periods of time. Okay, so your next exercise that we're going to do here is the squats. And there's multiple different ways to do this, but I'm going to tell you the best way to do a squat. The first thing you want to do, go ahead and do a squat, Rachel. Show them how you want to do it. Good. Okay, go ahead and stand back up. Now when she goes down, she's not going to put all the weight into her toes. She's going to put it into her heels. Okay, so do that one more time. So as she does that, all the weight's going into her heels and it's being distributed evenly throughout her muscles instead of when you go down your knees, or when you go down your toes, the weight's going to go into your knees, into your ankles, into your joints. And so when she goes down her heels, that's distributing the weight evenly through her muscles. And the best part about this squat, so go ahead and do that one more time, is it's really going to help add flexibility to your pelvic area. And this is big. When someone tries to squat, if you can't go, so go down just a little bit. If this is as far as you can go, that's fine. Start with that. But what I want you to do is get down to where you can go all the way down where your butt touches your heels eventually and keeping your heels on the ground and doing that. Now you see she's holding onto a chair and I'm sitting on this chair. That's to give her some stability. You want to get to the point where you don't need anything at all and you can squat all the way down and really hold that for about 5 to 10 seconds in that full squat position. What that'll do is allow your pelvis to stretch out a little bit, but it also strengthens all the muscles around it. So squats are very good. And I would say do those probably about 15 to 20, 3 times a day, all throughout the day. And what that'll do is just give you that stretch and that flexibility throughout your day. So when you're at work and you're sitting in the chair and everything's just building up, that's when you take a moment, grab the desk, grab the chair and try to do some squats and that'll stretch out your pelvic area and really add flexibility to your spine. Okay, so our next exercise, and this is going to be more of a stretch than a strengthener, but this one's valuable. This is something I do every single day. It really helps stretch the entire front part of your body, all the hip flexors and really the spinal flexors. This is a big exercise. This is one of your hip flexor or really full flexion stretches. I like to call this superstar because you're really getting to this superstar position. So show them your stretch here. So you see she goes all the way back. You can feel that stretch all the way throughout the front. You're going to feel that right in the hip flexor position. You're going to hold that for about 10 to 15 seconds. Go ahead and relax. And so then she's going to go into a neutral position again and then go back into it. Good, so then again, 10 to 15 seconds, and that's something, this is a stretch you can do every day, a few times throughout the day. Anytime you're feeling just really tired or locked up in your body, great exercise to do first thing in the morning. Okay, so this next exercise, this is the hip extensor stretch, and this is very similar to the hip flexor stretch, it's just the opposite, right? Okay, so go ahead and go into your stretch. Good, so Rachel's going to lean forward, and you're going to feel that right in that kind of buttocks area, and she's going to hold that for about 10 to 15 seconds, and then she's going to come out of that stretch with a push. So go ahead and push out. Good, and that's actually engaging the muscle, so when she goes back into the stretch, she's going to get more stretch than she did before. So do that again. So you see, the key is that you want to feel it right through the back of your legs, and that's going to help, again, open up the pelvic wall and keep your mobility throughout this area of your spine. This is a great exercise or stretch you can do throughout the day. Anytime you're feeling tightness in that lower buttocks area, many times you'll feel sciatic nerve pain, things like that. This is a great stretch for that as well. Okay, so our next exercise, really I wouldn't say it's an exercise, but it's a way of laying down that's going to help get the correct position into your spine. So many times patients ask me, how should I sleep at night? What kind of mattress should I use? What kind of pillow should I use? And I always go back to, I say, use your sleep aids. These are things I give every patient that comes into my office because it helps get the curvature back in your spine. We've talked so much about how important the curve is in your spine. Well, guess what? Your nervous system speeds up at night. And so when you're laying in a certain position at night, it's literally forming your body. So if you're laying on your stomach with your head turned to the right like this or to the left, it's going to turn your spine into that position. If you're sleeping with a lot of pillows with your head real far forward, again, it's going to turn your spine to that forward headward posture position. So we use spinal sleep aids. Okay, they look just like this. They're spinal sleep aids. Rachel's going to show us how these things work. Go ahead and lay on your back. First one's going to go in her low back. Good. Next one's going to go, and lift up a little bit. Good. Right in her neck. And as you can see, this creates a curvature right in her neck. And even though this doesn't look very comfortable on this table, when you're at home, you put these things in your back and you lay on them. And at first they're a little hard, but after a while you get used to them. And these things are awesome to sleep on at night. They actually put a curvature into your neck. And this is one of the best ways we actually get spines to start to change in our office is something as simple as this. So you want to try to sleep on it, but if you can go 20 minutes at least at night, it's really going to make a big difference in the structure of your spine.